Welcome to the School Mental Health Minute. This is a weekly webcast that focuses on mental health and school issues for children and adolescents. We'll highlight some of the newest research findings and translate the impact and implications of these findings. All this in a couple of minutes. I'm Dan Florell, and let's see what this week's study has to offer. We are featuring a journal article this week titled Racial and Ethnic Disparities in ADHD Diagnosis from Kindergarten to 8th Grade. The authors wanted to find out to what extent ADHD diagnoses vary among racial and ethnic groups in early and middle childhood. They used a federal database that followed over 17,000 children for several years to address the issue. The authors found that children of racial and ethnic minority groups were much less likely than otherwise identical white children to receive an ADHD diagnosis. African Americans were 69% less likely, and Hispanics were 50% less likely to be diagnosed with ADHD than white children. These disparities in diagnosis became evident in kindergarten and continued through 8th grade. When racial and ethnic minorities were diagnosed with ADHD, they were much less likely to use prescription medication to treat the disorder. In addition, children in general were less likely to be diagnosed when they had higher academic achievement, more frequent learning-related classroom behaviors, and did not have health insurance. Those who were more likely to be diagnosed tended to be boys. They frequently engaged in externalizing behaviors and were raised by older mothers. The takeaway is that schools and other health providers should institute a more systematic way of identifying children with ADHD and to take care to listen and reach out when minority parents express concerns about their child's learning and behavioral difficulties. That concludes this webcast of the School Mental Health Minute. Come back next week, and thanks for watching.